The business of medicine is constantly changing. The review by Resolve discusses current contract issues for physicians, compensation trends, and tips for a successful career. Every physician's contract and career is different, and nothing in this episode should be considered legal advice. If you have specific questions about your career, please consult with an attorney. Now, on to the show.
Welcome back to the review, where we talk all things physician contracts. I'm here today with Mary Wolf, the president of Veritee Partners. Mary is an expert in all things physician wellness. And so we're going to dive into, one, what that is, what your experience with that looks like, how that interacts with physician contracts. And so I'm really glad you're here.
Thank you.
Yeah.
Good to be here.
Yeah. So I want to start out with a really broad question.
Sure.
And the first question is, how do you define physician wellness? Like, what does that mean?
Wow, that's a big question. I'm always used to answering what's physician burnout. So for me,
can go there too if you want.
as I work with physicians, the main thing for physician well-being is, are they living by their values?
Okay.
So when I think about when they bring me a contract, I look at, is this aligned with your values?
Okay.
So a physician who values efficiency might like a little higher productivity, and a physician who values relationships, they're going to want a little lower productivity because money isn't as important, but patient relationships is.
Sure.
So for me, helping physicians align with their values and what they really want, both at work and home, which is important to consider both. That's where I see physicians doing really well in that sweet spot when they know their values, they're living it, and their contract reflects it.
Yeah. So you said burnout's the question you get most often, and people use that all over the place.
Yes.
I mean, there's been studies on it. There's been 1,000 blog posts about it probably. What do you see? I mean, what does that mean to you? What do clients tell you? What does burnout mean?
I mean, there's research around burnout, Maslach, and when you're really just emotionally exhausted, lack of empathy, just feeling like you're not achieving. So those are the three characteristics that Maslach talks about for burnout. But what I see day to day in physician burnout, they don't fit those nice three little categories.
Yeah. So what's it look like to you?
So the main thing is often irritability.
Okay.
So that's the number one reason that physicians are referred to me, is frustration, irritability, not themselves, meltdown. It's not that they can't handle stress or they're not resilient. It's just the day kind of accumulates on them. Yeah. And then they end up just kind of unleashing on somebody. And irritability is a sign of depression that people don't think about. But often it is, what I see is just that really anger or edge that physicians have that get them to referred to me. And then we start delving into all of the reasons why they're burned out.
Do you feel like there's a certain, and this is probably hard to answer, is there a certain demographic of physician that tends to be more burned out? Like, is it a certain specialty? Is it a certain age?
The research shows that primary care physicians are at the top of the burnout. Okay. The demographic is often 8 years into practice. So they're all excited to start a practice and 8 years in, and they're all about proving themselves. And then they realize, is this all there is to see patient after patient? And so
kind of that early to mid career. Kind of the newness is worn off, and
it is.
It's not the people that are about to retire because they probably don't care anymore, right?
That's right.
They're like, I can get through this.
And they're trying to raise kids. Yeah. So about 8 years in, they probably have 2 children by then, and it's just all feeling overwhelming. Okay.
Is there any distinction from what you've seen, research or personally, male, female?
So male physicians do not see their work as declining. Okay. Female physicians do, and that is researched from Tate Shannonfeld, one of the top physician burnout researchers. And I see that in my work as well. Male physicians are mandated to see me. most of the time, female physicians are voluntary.
Sure.
They've heard from a friend or a colleague about me. They've seen me speak, and they just say, I'm not doing well.
Yeah.
I'm not doing anything well. Home,
Sure.
work, marriage, anything. And so they identify quicker that there's an issue.
Yeah. Interesting. Do you, I guess maybe, are there certain factors, and you're mentioning family and kids and things like that, but from a non-work standpoint, are there certain things that successful physicians, successful from a wellness standpoint, are doing that the, what I'm going to call unsuccessful ones are not doing?
So one of the main things I work on with a physician who is burned out is really looking at, does their self-worth come from their productivity? And their identity as a physician. Because if they're just chasing, RVUs,
work RVUs,
and more money, and that's how they're getting their self-worth, they're going to burn out rapidly. If they're getting their self-worth from being really good with their patients and having successful outcomes and being a great partner at home and a great, parent and, a sibling, and they're well-rounded in all their roles, they're going to do a lot better in well-being than if their whole identity and self-worth is wrapped up into being a physician.
Sure. Yeah, and that makes sense. I mean, they've spent almost all of their educational life at least preparing to be this thing, and then if that all of a sudden doesn't create that satisfaction, and I can see where that would be frustrating.
And that's the hard part about burnout then too, is they're feeling like, I don't know if I can do this. I always talk about, is your pace sustainable?
Yeah.
And if they're feeling like it's not, some can get suicidal because they have worked this hard and their identity is wrapped up in being a physician.
Do they, I had a bunch of questions written down. This is not one of them.
Okay.
So do they like the word burnout? Because when I hear that word, I feel like, I'm male.
They like it better than the word resilience.
Okay.
So a lot of times physicians are told they're not resilient, and they are the most resilient people that I work with. So they are learning more and more about physician burnout.
Okay.
So they don't mind that term, but they often feel like people think they're not strong enough when really they have the wrong definition of resiliency. So they think resiliency is you just keep going, you gut it out, and just, plow through it.
Yeah.
Really, resiliency is working hard, rejuvenating, then giving full effort.
Okay.
And physicians don't realize they need the rejuvenation. They just get up the next day, do it again. They're doing locums on the weekend. They didn't rejuvenate over the weekend, and they just do it again and again. So I see them much more frustrated with being called not very resilient than burned out.
Yeah. So, okay, I'm going to go to some of the questions I did have written down. So one of the things that you've talked about is kind of this recharge, right?
Yes.
How often does scheduling problems or inefficiencies in the clinic or too much call, how often does that come up in your conversations?
All the time.
Yeah.
So my passion is prevention.
Okay.
So if I can get a physician to you sooner and looking at contracts and looking at, is it sustainable to do every other weekend call?
Right.
And maybe they have to initially because they're short physicians at that.
For sure.
So, but then do you put it in the contract after 6 months, it goes to 4, every 4 weekends.
So call is stressful.
So call is what puts people over.
Yeah.
They say, I don't mind my clinic or I don't mind my surgery days. It's my call that puts me into that overwhelm.
Interesting. Okay. Do they have, or I should say, does staff interactions, right? Meaning either being understaffed from a support staff standpoint or just having difficult coworkers.
It is.
How does that affect their personal well-being?
The short staffing that healthcare is seeing right now, it's affecting physician burnout. So I hear from physicians, I have a different nurse every week. So in the clinic, you just get used to the flow of your nurse and the process and efficiency, all of those things. And now you're retraining a nurse on how you like to do things.
Sure.
And same way with a surgery tech.
Yeah.
they're not getting the same surgery tech anymore. It used to be this great, you'd be paired with your team, and you could walk in confident. They knew you, you knew them, and that team dynamic just makes things enjoyable and efficient.
Yeah.
And that's
there's a level of trust there too. I mean, if you're doing a
trust.
surgery, you want to be confident.
Such a level of trust. And so then physicians kick into high gear and they'll say, I'll do it myself. I'm not going to ask my nurse. I'm not going to ask the tech. I'm not going to ask whoever to help. I'm just going to do it myself because I don't know the quality of their work. You're absolutely right.
Yeah. We had a client who would tell us that every week when they walked into the OR, it was like a new day, right? It was I had to tell which tray I needed and which, all this stuff. And I thought, man, I don't like to do my job that way. I can't imagine, that type of environment.
And then they get behind because of that. They're explaining, this is what I need. Or then they're really frustrated because the right equipment or parts aren't in the surgery room.
Sure.
So that is when often they just get pushed and pushed.
Yeah.
Because it's all those little things that build up.
So are there early warning signs?
Irritability, for sure, is the top one. And, what do we do to really irritable people? We back way away.
Sure.
Give them lots of space. It's the opposite of what you need to do.
Yeah.
Hey, you don't seem like yourself. What's going on? Can I help? So definitely irritability.
Okay.
But then just the kind of apathy. So they used to be really good at getting charts done.
Sure.
And now they are 100 behind.
Yeah.
That's also when I get referred.
Okay.
Is when physicians get far behind on documentation.
Sure.
So that's definitely another sign. But also someone who is really social all of a sudden is just in their office doing their work. They don't talk to anybody when they're in the clinic other than their patients.
Yeah.
And isolating and really pulling back. They just are not themselves. And
so
a lot
for
of times,
any spouses or friends listening to this, right? It's if you see these types of characteristics, there may be some burnout.
Absolutely. I often had. I used to present at onboarding for physicians, and spouses were invited, and spouses would come up and just say, "Oh my gosh, I'm seeing all these things. How do I get my spouse in to see you?" And they often are seeing that irritability. They're not sleeping.
Okay.
They're maybe not eating.
Okay.
They've lost weight or gained weight. They're not exercising like they used to. They dread going into work. They're grumpy when they're on call.
Yeah.
Like just their whole kind of personality changes.
Okay.
With burnout. They lose hope that they can keep doing this. And I hear that a lot. I just don't think I can keep doing this. And
sure.
Some physicians say, I'm going to quit and I'm going to start a lawn mowing service. I heard that once.
Oh, just complete career change. Okay.
Absolutely. That burnout just has them thinking of a complete change.
So if there was, this is a contract, right, audience. And so if there was one maybe piece of advice or takeaway that you could give to maybe any employer that would watch this, right, like a large system, how can contracts help on burnout, well-being? I
think really explaining what that contract looks like in that setting. As you know, if you've seen one clinic, you've seen one clinic.
Yeah.
So if administrators could actually go over what this looks like, because especially I work with quite a few rural physicians as well.
Yeah.
So they have no understanding what overseeing the clinic, the hospital, the emergency department, the nursing home, and in one case, they were also the coroner.
Yeah.
And what that would look like.
Yeah.
So if they could get really specific about this is what a week might look like.
Yeah.
And help them understand what and what census is. A lot of times you think, oh, it'll be such low census. It's a small facility and they're packed because it's cold and flu or whatever it might be. So I just see a lack of understanding of what it really means when you have that many different hats to wear.
Yeah. One of the concerns that we often have, not all the time, but often have, is that the language around duties and responsibilities, which is kind of what you're talking about. It starts out being drafted by their attorney, which I would do if I was on their side too, but they want a lot of flexibility, right? So it says this physician is going to work, kind of when we tell them to and where we tell them to, right? Different facilities, and we'll set the call schedule, and that's kind of it. And there's not a lot of specifics there.
There's no role clarification. Yeah. That's what I want more of. What does a week look like? And more physicians are writing into contracts they want a scribe more and more, or some kind of AI software. Right. I also am working with new CMOs who wrote in their contract executive coaching those first 90 days.
Sure.
And I think that's also another great time to have contracts reevaluated, is when they're going into a leader role, and now they are half-time.
Yeah, their CMO, FTE changes,
and then they're half-time clinical. But again, that role isn't clarified very well. And in my experience, when there's a new CMO role and it's half-time, it's closer to full-time and a half-time clinical.
Right. Yeah, protecting time is really important.
It is.
It's half days turn into full days a lot. So admin days tend to turn into maybe some patient care, right? Patient-facing time. So I do think protecting time is a key.
Yeah, I work with physicians a lot on that too, on trying to do some block scheduling and not constantly having disruptions. Because you're exactly right. When you switch back and forth to, I'm going to jump in and see a patient, and then I'm going to be on an admin call, then I'm going to do a note, then I got interrupted because I need to put orders in. Like, that's also burnout, because you can never focus anywhere.
Sure. Yeah, you're preaching to the choir with me. Okay, so let's talk about, we don't want physicians to go into lawn mowing because there's a shortage already, right? We need them. And so how would you... what's your advice to folks that are burned out? Like, how do you help them through that process?
Yeah, I have a 3-step process I work with them: clarity, strategy, agility.
Okay.
So clarity, we get really clear about those values. What is it that's not working? Where is a values clash between you and your employer?
Yeah.
And is there a values clash between you and your spouse on spending?
Sure.
And then really looking at a strategy. And it's so individualized, as you know.
Yeah.
Sometimes it's looking at an overhaul and how they do their records and documentation. And sometimes that's part of the strategy. Sometimes I bring in a spouse and talk with them about, hey, are you okay if there's going to be less money and maybe you sell the cabin, but they're going to go and as a primary care, they're only going to see 15 patients a day. Are you okay with that?
Yeah.
And is that the strategy? And what's the strategy when that physician gets home? Is there a transition time? That's a really important piece, especially if they've been, just back to back.
Sure.
So looking at some of those things. And then agility is the third one. So yes, there's a strategy, but as things ebb and flow, you might need a plan B, a plan C, a plan D. And then there's also that helping physicians look at renegotiating a contract, which is not popular, as you know, from administration. But it might be like, I helped a physician recently where they were planning on one more child and ended up with twins.
Oh my.
And so really wanted to renegotiate that contract and look at, can I do 3 days instead of 5?
Yeah.
Can I, take some different way of call? So renegotiating contracts is recommended, but it's not always received very well.
Yeah, I'm hearing a lot of kind of personalization, and every physician's different, which we completely agree, because every specialty is different, and then every physician within that specialty is different. Do you think standardization of contracts is helpful for burnout?
I don't.
Yeah.
Because it goes back to those values. If a physician loves that efficiency and just really enjoys the thrill of getting a patient done in 15 minutes or whatever, then that's going to work for them.
Right.
But those that really want time for their patients, and that's why they went into medicine, they're going to hate that standard contract. But I can see why administrators like it, but it's not helping. the physician with their well-being.
Yeah. Yeah. We agree. I mean, every person has such unique needs, and we know that there's a shortage of physicians. We know that it's hard to retain them.
It is.
Hard to recruit them too.
It is.
But once you have them, it just feels like, boy, if we can get somebody to 3.5 days instead of 4 to keep them, or, give them a little less call to keep them, it feels like there should be some flexibility there.
Sometimes administrators will refer a physician to me to really look at what they want.
Yeah.
So they're just really burned out. They may have taken a medical leave, and they'll say, we want you to work with Mary on what is going to be sustainable and how are you going to actually be fulfilled in your career?
Sure.
How do we help you thrive instead of just stay on this survival hamster wheel kind of thing? So I'll also get involved in those situations where the administrator isn't sure how to help them.
How to solve the problem.
Because they know what they need, and they know that they need someone objective, confidential, to talk to about what is it that you really want to do. And I've had physicians say, I hate my specialty. I think I'm going to go back for a different one.
Sure.
And I've had people do that. They've had to move and do another fellowship or residency, and they go into a whole different specialty.
Yeah.
Again, not easy decisions, but when you start looking at values and burnout and well-being and life is short, people are willing to make changes and shift so that they are putting well-being and their family's well-being at the forefront.
Yeah. So I think what I'm hearing you say is that physicians should be thinking about this, right? Even if they don't think they're going to ever be burned out when they're young.
Yes.
It might happen.
Yes. I work with a lot of residents as they're getting their first job and interviewing, and we look a lot at values. Do you want to live in a small town if you're a psychiatrist?
Sure.
I wouldn't recommend that. And do you want your kids going to a small school or a really large school with lots of opportunities? Is your spouse going to be able to find employment? And really looking at all of those values questions as they're looking at which contract. And a lot of residents say to me, I'm going to take the first one. It's money.
Yeah, right. Such
I'm
a big
so
jump
ready.
in value. That's right. Yeah.
And I'm slowing down their process and saying, you can make the decisions and hold off and compare a few and, obviously go and see what you think in the community, but you have to think about it through the lens of your values. Every contract, every offer needs to be looked at. It's like a partnership. You have to look at all the financials and yes, the productivity and all those things, but I wish more physicians would look at it from the productive or the values alignment instead.
So if there was one contract clause that you could put into every contract, if you had the magic wand to help with burnout and well-being, what would it be?
This contract will be reassessed in 1 year.
Okay. Life changes.
And you can't predict what that is going to feel like.
Yeah.
And physicians say, I'm so stuck. I can't renegotiate. I've asked. I can't. I'm stuck. I have to do this. And if they knew that they were going into, 1 year and they could assess at the end of 1 year, and often it is because physicians are on a guarantee that first year.
Sure.
So often it is, but I really think it would help if they knew they could reassess. And I would like that to be a sit-down meeting and giving and receiving feedback.
Sure.
Physicians desperately need that, but they also need to learn how to do that. That's the number one skill that I see that physicians need is giving and receiving feedback. Sure. So
kind of an annual review of the contract, an annual review of their situation, their compensation, all of it to make sure they don't burn out.
Yes.
Yeah.
And offering them services.
Sure.
At that 1 year point if they're struggling. So I like to do training with administration, clinic managers on how to see those signs and symptoms earlier and how to make a good referral to resources, because I've had some really bad referrals to me.
Of course. Yeah. Well,
Yeah.
I think physicians would be wise to take some of this advice, right? To make sure they're finding folks like you if they are getting that irritability, the burnout. We hope that they look at their contracts and protect themselves that way.
Yeah.
Any final closing thoughts you'd have?
Yeah, I think when they're also looking at the new job, it's okay to ask questions in the interview about, do you focus on well-being here? A lot of facilities, a lot of health systems now have well-being programs.
Sure.
And a lot haven't started.
Yeah.
And so I also tell physicians, ask if you can talk to a colleague that you would be working with, and ask them if well-being is a focus. Ask them if they offer resources. Ask them what it's like.
Sure.
So I think just being much more proactive in those interviews. Again, they're just so happy to have a job and excited that I think they forget about asking what the culture, and is it a culture of well-being?
Sure.
And asking more questions up front and thinking about what they truly want up front.
Very good.
Yeah.
Well, I appreciate all the recommendations. I hope all the viewers take it to heart, and we'll have you back on.
Sounds good.
All right.
Thank you.
Thanks, Mary.